Hey everyone, and welcome back to the channel. Today we're diving into a topic that's becoming more and more relevant: cannabis use disorder. With changing laws and social views, it's more important than ever to understand what this condition is, who it affects, and what help is available. So let's get into it. First off, what exactly are we talking about? Cannabis use disorder, or CUD, is a recognized mental health condition. It's when a person's use of cannabis or marijuana becomes problematic, causing them distress or getting in the way of their daily life. It's a specific type of substance use disorder. Now you might hear the terms cannabis and marijuana used interchangeably, but there's a key difference. Cannabis refers to the whole plant and all its products. That includes things like CBD. Marijuana, on the other hand, specifically refers to the parts of the plant that contain significant amounts of THC. That's the chemical that produces the high. So, while all marijuana is cannabis, not all cannabis is marijuana. Cannabis use disorder mainly revolves around substances that contain THC. CUD isn't a simple on or off switch. It exists on a spectrum, from mild to moderate to severe. At its core, it often involves a powerful urge to use cannabis, needing more of it to get the same effect, which is called tolerance, and experiencing withdrawal symptoms if you try to stop. The most severe form of CUD is what we'd call an addiction. This is when someone continues to use marijuana compulsively, even when it's causing clear, negative consequences in their life. You might be surprised to learn how common this is. Back in 2021, it was estimated that about 16.3 million people in the United States, aged 12 and over, had experienced cannabis use disorder in the past year. That's nearly 6% of that population. This shows that it's a real issue affecting millions of people and their families. So what are the signs to look out for? According to mental health professionals, there are several key indicators. One is taking cannabis in larger amounts or for a longer period than you originally intended. Maybe you plan to just use it on the weekend, but now it's a daily habit. Another big sign is having a strong, persistent desire or urge to use. You might find yourself thinking about it a lot. Many people with CUD have tried to cut down or control their use but haven't been successful. They might also spend a significant amount of time getting cannabis, using it, or recovering from its effects. This can start to interfere with major responsibilities at work, school, or home. Maybe grades are slipping or work performance is suffering. The disorder can also strain relationships. A person might continue to use cannabis even when it's causing arguments or problems with family and friends. They might start giving up important social, work-related, or recreational activities that they used to enjoy, all because of their cannabis use. Using cannabis in situations where it's physically dangerous, like before driving a car, is another red flag. And a crucial sign is continuing to use despite knowing it's causing or worsening a physical or psychological problem. For example, if someone has anxiety and notices cannabis makes it worse, but they keep using it anyway. And as we mentioned earlier, two classic signs are tolerance, needing more to feel the same effects, and withdrawal. Cannabis withdrawal can include symptoms like irritability, anxiety, sleep problems, and decreased appetite, which are then relieved by using cannabis again. Other behavioral changes can also appear. Things like memory issues, confusion, sudden mood swings, or becoming hostile or secretive when asked about their use. Some might neglect their personal appearance or withdraw from friends and family. These aren't just personality quirks. They can be symptoms of a developing problem. How does someone get to this point? It's usually a gradual process. It might start with experimental use, maybe out of curiosity. This can progress to occasional use, then to heavy, regular use, and for some, it can ultimately lead to a substance use disorder. This path is different for everyone and is influenced by a combination of factors. Let's break down those causes. First, there's brain chemistry. THC, the active compound in marijuana, directly affects your brain's reward system. Normally, things like eating a great meal or spending time with loved ones release a chemical called dopamine, which makes you feel pleasure. This motivates you to repeat those healthy behaviors. THC floods the brain with a much larger surge of dopamine. Over time, this can rewire your brain. The massive dopamine hits can make normal, healthy pleasures feel less rewarding. This creates an unhealthy drive to chase the high from marijuana instead. Your brain chemistry actually changes, and you become desensitized, which is why tolerance builds up. Genetics also play a huge role. Studies suggest that 40% to 60% of a person's vulnerability to any substance use disorder comes from their genes. If you have a close biological relative like a parent or sibling with a substance use disorder, your own risk is higher. Scientists have even pinpointed specific gene variations that are associated with a higher risk for CUD. Co-occurring mental health conditions are another major factor. About half of the people with a mental health condition will also experience a substance use disorder at some point, and vice versa. This is called a dual diagnosis. Conditions like depression, anxiety, or PTSD and CUD often go hand in hand because they can share overlapping causes, including genetic vulnerabilities and similar brain pathways. Some people might start using cannabis to try and self-medicate the symptoms of their mental health struggles, which can unfortunately lead to a substance use disorder. And finally, we have environmental factors. Simple excess and exposure are significant. If cannabis is used regularly in your household or among your peer group, your risk increases. Other risk factors include starting to use at a young age, the potency or THC concentration of the cannabis being used, the frequency of use, and using other substances well. The consequences of CUD can be serious and affect every aspect of a person's life. On the physical side, it can lead to conditions like cannabis-induced psychosis or anxiety disorders, sleep problems, and chronic bronchitis if the cannabis is smoked. There's also a rare but severe condition called cannabis hyperemesis syndrome, which involves cycles of severe nausea and vomiting. For adolescents, the risks are even greater. CUD can alter brain development, impair thinking and memory, and lead to poor school performance. So, how is it diagnosed? There isn't a single blood test or scan. Instead, a healthcare provider or mental health professional will conduct a thorough evaluation. They'll look at your medical history and discuss your behaviors and patterns of use. Based on the criteria in the official diagnostic manual, the DSM-5, a person must show at least 2 of the signs we discussed earlier over a 12-month period. The severity is then determined by the number of signs present. 2 to 3 is mild, 4 to 5 is moderate, and 6 or more is considered severe. The good news is that cannabis use disorder is treatable. Recovery is absolutely possible. Treatment plans are tailored to the individual and the severity of their disorder. The first step for many is detoxification or detox. This is the process of safely stopping cannabis use and allowing it to clear from your system while managing withdrawal symptoms. After detox, psychotherapy or talk therapy is the cornerstone of treatment. One of the most effective types is cognitive behavioral therapy or CBT. CBT helps people identify and change the negative thought patterns and behaviors that lead to substance use. Other helpful therapies include dialectical behavior therapy, or DBT, and contingency management, which provides rewards for staying substance-free. Treatment can happen in different settings, from outpatient counseling to more intensive inpatient programs. For many, support groups like Marijuana Anonymous are also a vital part of long-term recovery, providing a community of people with shared experiences. The road to recovery isn't always straight, but with the right support, people can and do recover and go on to lead full, healthy lives. If you recognize some of these signs in yourself or someone you care about, the most important step is to seek help. We all go through times of stress and change, and it's during these times that the risk for substance use can increase. It's so important to have healthy coping strategies like exercise, meditation, talking to friends, or finding a new hobby. If you're struggling to manage stress or your mental health, talking to a therapist can make a world of difference. If you or someone you know is struggling, please know that help is available. You can talk to your doctor, a mental health professional, or reach out to a helpline. Thanks for watching today. I hope this information was helpful and shed some light on a complex topic. If you found this video valuable, please give it a thumbs up and consider subscribing for more content on health and wellness. Take care of yourselves and each other. The information provided is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you have read or heard here.